Hi, we're going to talk about a little bit about Dysport, and we're just going to demonstrate Dysport injection technique. Our patient here has a wedding she's going to in about 3 or 4 days, so even though in the past we've done both Botox and Dysport for her, since Dysport kicks in a little quicker than Botox, we're going to switch to Dysport for her today. She should start seeing results in the next few days, but just like Botox, it takes up to 2 weeks to see the full results. The injection that we're going to do today will be to all three areas, which is the glabella, the central forehead, and the crow's feet and lower lid areas. The dose that we'll use will be a 3-to-1 relationship between Dysport and Botox. So, as I mentioned before, if we do 1 unit of Botox, we're going to do 3 units of Dysport. Now, nationally, if you look at the numbers, doctors do between 2, 2.5 to 3 times. 3 times is actually quite rare. I like the 3 times dose. We end up losing money on the injection, but the patients get a better result. I think 3 times the amount of Botox, so for example, again, 20 units of Botox to the glabella would equal 60 units of Dysport. If you cheap out on it and do about 40 to 50 units of Dysport to the glabella, the results are just not as nice as if you do 3 times. So what we've done is we've dropped the price of our Dysport per unit just so patients can get a better benefit out of it. Now we're going to show the technique of drawing up our Dysport, the way that I mix it. This comes out to about 6/10 of a cc. We're going to start in the glabella. We can zoom in close so we can see this area. Go ahead and frown for me, and you can see. Now go ahead and wrinkle your nose. There you go. Now we're going to leave the bunny lines alone. She doesn't have a lot of procerus, so we're going to put just the smallest drop right here. And then concentrate more on the depressor, the corrugator. With Dysport, you definitely want to stay more medial because it does travel a little bit more than Botox. If you get a blood vessel in the way, you just hold a little pressure and it will stop. While I'm holding pressure, we're going to go to the other side. Again, the depressor. And we'll start getting the corrugator. Raise your eyebrows for me. Okay. She's got a very nice lateral raise. We're going to keep those for her. So we're just going to concentrate just a few little drops in the central forehead. And leave the outer alone for her so she can raise it. Again, a nice little blood vessel. Gets in the way, just hold a little pressure, it'll stop. Things that make bruising worse are obviously any kind of aspirin containing medications, ibuprofen, NSAIDs, some supplements such as ginkgo, echinacea, vitamin E, flaxseed, fish oil, all those can make you bruise more because they thin out the blood. We're going to go around the eyes while I'm still holding pressure. You go down here and you can see this one is just right under the skin. Form the bleb. You can see the nice bleb. No bleeding because it doesn't go into the muscle. You can see I raised the eyebrow because I want to go underneath the brow but outside of the orbital bone. Another drop there, let it go. Come down to the bottom part of the crow's feet. Another bleb. And finally, my little advanced technique, which again as a beginner you should not attempt, but if you feel comfortable with anatomy, by injecting the lower eyelid area, you get a nice smoothness all throughout. Because what happens is if you avoid this area, this crow's feet area gets all smooth, and then when you smile, you see more wrinkles now on the lower eyelid, which is not a nice look. We're going to go to the other side while I have her hold this herself. Good. Go up here. Again, you can see one little bleb. Lift the brow up. Another bleb. Three. This one burns the most typically. I'm going to have you hold this now. I've got a little left. What I'm going to do is I'm going to come back up here, put it in the central compartment, and just let it spread. Hold a little pressure. That's it. So out of all those injections, She'll probably get a tiny little bruise right here. This one's barely even noticeable. It's easy to cover with makeup, and it should fade away in a few days into kind of a yellowish greenish spot that's barely noticeable. But again, if you have something major coming up, you shouldn't do the injections right before this, but we have about 4 or 5 days for that tiny little bruise to kind of fade away and be able to be covered with makeup. And the nice effects of the relaxation that the Dysport will give her outweighs a tiny little spot there. That's it. Thank you.